am going to be talking about diabetes in older adults. My name is Carolina Pronto. I am an LPN in the LPN to BSN nursing program at Indiana State University. The learning objectives for today are: at the conclusion of this presentation, the viewer will be able to classify a population at risk and how an individual 65 years or older fits into this category. At the end of the video, the viewer will be able to explain how diabetes can be diagnosed. At the conclusion of this presentation, the viewer will be able to identify at least 2 signs of diabetes. And at the conclusion of this presentation, the viewer will be able to list 2 non-pharmaceutical ways to manage diabetes. At this time, if you could stop the video and take a look at the pre-test and complete that, as well as taking a look at the handout that accompanies this presentation. As soon as you are ready, if you hit play, we will continue. A population at risk is a population that is at a higher risk for poor health outcomes. Older adults greater than 65 years old is who we're talking about today as our population at risk for diabetes. According to the American Diabetes Association, or the ADA, about 25% of older Americans are diagnosed with diabetes. In contrast, the CDC states in a population of adults over 20 years old, 15.9% are living with either diagnosed, as in diagnosed by a physician, or undiagnosed, as in not yet diagnosed by a physician, diabetes. 11.3% of those adults over 20 are living with diagnosed diabetes, which shows the contrast of adults over 65 with diabetes at 25% and the rest of the population of adults over 20 with 11.3%. Diabetes is important because it increases the risks of cardiovascular diseases such as hypertension and stroke, as well as being linked to dementia in older adults. These are already issues that this population faces due to their age. What is diabetes? According to the CDC, it is an increase of glucose or blood sugar in the bloodstream due to insulin issues in the body. Those issues can be caused by the pancreas not creating any insulin, not enough insulin, or the body not being able to use the insulin that's being provided. Type 2 diabetes, which is the type of diabetes you would typically see in the older population, develops over time and can be preventable. Diabetes creates complications in many organs and organ systems in the body, such as the more common ones like the cardiovascular system, putting an older patient at risk for stroke or heart block, such as a heart attack. Kidneys, putting them at risk for kidney failure. The eyes, putting them at risk for vision loss. Skin and nerves, putting the patient at risk for having wounds on the feet and not being able to feel that there is a wound there, as well as poor wound healing. How is diabetes diagnosed? There are different ways to diagnose diabetes. More common ones are diagnosing through blood work, such as an A1C, which is a test that averages the blood sugars over 2 to 3 months. This test checks to see what percentage of the hemoglobin surface is covered in the blood sugar. Everybody has some sugar attached to their hemoglobin, but a patient with higher consistent blood sugars has more sugar attached to their hemoglobin than a patient without diabetes. Another common way to diagnose diabetes is through fasting blood sugar, which is generally done on a metabolic panel while fasting. Pre-diabetes, the A1C for a pre-diabetic would be 5.7 to 6.4, and the fasting blood sugar would be 100 to 125. This would be seen and not diagnosed until it was monitored several times on lab work. Diabetes would be a A1C of 6.5 or higher, as well as fasting blood sugar 126 or higher. Again, they typically, unless a diabetic panel comes back abnormally high, it is typically seen over a few blood works. What are some signs or symptoms of diabetes? Diabetes symptoms are not always clear, especially in an older adult patient who may already have these signs or symptoms due to age. Some common symptoms of diabetes are feeling excessively thirsty or feeling excessively hungry, urinating often, blurry vision, which is already something that is seen in an adult patient due to possible glaucoma or cataracts or just due to age. Slow healing wounds. This is something that is a complication in diabetes. Tingling pain, numbness in the hands or feet. This is also a complication seen in the nervous system for a patient who has diabetes. And also extreme fatigue, which is also seen in a patient of Medicare age or a patient 65 or older. How to manage diabetes and to try to prevent diabetic diagnosis is to monitor blood sugar through regular healthcare provider follow-ups. And then in the event that there are any elevated blood sugars or consistently elevated blood sugars, monitoring with at-home testing kits. A good way to manage diabetes is through weight loss, staying active, and managing your diet, following a low carbohydrate diet. Carbohydrates turn into sugar in the body, and eating a high carbohydrate diet can lead to diabetes. A good way to prevent this is to eat a lot of protein in the diet and follow a high fruit, high vegetable diet, eating a lot of healthy, nutrient-full foods. Another way is to follow up with other providers to make sure that you are not having any complications of the disease. Diabetes does affect the eyes, and eye exams are a good way to make sure that you're not having any complications that lead to any vision loss. At this time, if you could please pause and complete the post-test, as well as taking a look at the handout if you have not already done so. And here are the answers to the post-test. These are references, and if you would like to get more information, there is good information at the American Diabetes Association website listed here, as well as Centers for Disease Control, Prevention, and the website here in the reference. And thank you very much for listening. I hope you learned a lot of information.